Good afternoon, everyone. Today, I will be presenting my analysis of the case, the AI Scribe, enhancing physician presence and curbing burnout at Mass General Brigham. Specifically, I will be focusing on case question number 2, which asked us to identify and analyze the central issue presented in the case. As we review the case, we found that the primary challenge facing Mass General Brigham was physician burnout caused by increasing documentation requirements and the organization's effort to address the issue through AI-powered Scribe technology. Through this presentation, we will explain how this issue developed, why it is important, and what consequences might occur if it is not resolved. So, going into our introduction, healthcare organizations today face numerous workforce challenges, but one of the most significant is physician burnout. Physicians are expected to provide high-quality patient care while also completing extensive documentation requirements. As electronic health record systems have become more common, physicians spend a growing amount of time entering data, updating records, and completing patient notes. Why documentation is very important for patient safety, legal compliance, and insurance billing, it has created a substantial administrative burden. Many physicians report spending hours after work completing documentation tasks. This growing workload has contributed to stress, exhaustion, and decreased job satisfaction across the healthcare industry. Mass General Brigham is one of the largest healthcare systems in the United States. The organization employs approximately 85,000 people, including thousands of physicians, nurses, and healthcare professionals. Because of its size and influence, workforce challenges within the organization can have a significant impact on patient care and organizational performance. Leadership at Mass General Brigham recognized that physician burnout was becoming a serious concern. They understood that burnout not only affects employees but can also impact patient outcomes, productivity, and retention. As a result, the organization began exploring innovative solutions to reduce administrative burdens and improve physician well-being. Before discussing the central issue, it is important to understand what burnout means. Burnout is a state of emotional, physical, and mental exhaustion caused by prolonged workplace stress. In healthcare, burnout can occur when physicians face high demand, long hours, and increasing administrative responsibilities. Burnout often leads to lower job satisfaction, decreased engagement, reduced productivity, and a higher likelihood of leaving the profession. The case notes that approximately 45% of physicians experience symptoms of burnout. This statistic highlights the seriousness of the problem and demonstrates why healthcare organizations must actively address employee well-being. The central issue in this case is physician burnout caused by excessive documentation requirements and the challenge of implementing AI Scribe technology effectively while maintaining patient safety and quality of care. Physicians were spending a significant portion of their day completing documentation rather than interacting with patients. Many continued documentation tasks after normal working hours. As a result, stress levels increased and work-life balance suffered. To address this problem, Mass General Brigham introduced AI Scribe technology, designed to automatically generate clinical notes from physician-patient conversations. The issue developed over time as healthcare organizations adopted electronic health records and expanded documentation requirements. Electronic records improved information storage and communication, but they also increased the amount of administrative work required from physicians. Healthcare providers must maintain accurate records for patient care, regulatory compliance, and insurance reimbursement, and legal purposes. While these requirements serve important functions, they have unintentionally increased physician workloads. In many cases, physicians spend more time interacting with computer systems than with patients, which contributes directly to burnout. From a human resource management perspective, burnout creates significant challenges for employees. Physicians experiencing burnout often report increased stress, emotional exhaustion, and reduced job satisfaction. Over time, these conditions can negatively affect performance and engagement. Burnout also impacts work-life balance. Many physicians reported spending evenings and weekends completing documentation tasks. This reduces time availability for family, personal interests, and recovery. As the burnout increases, organizations may experience higher turnover rates and greater difficulty retaining experienced healthcare professionals. The effects of burnout extend beyond physicians themselves. When physicians are overwhelmed by administrative responsibilities, patient interactions may suffer. Less time is available for communication, relationship building, and personalized care. Patients may feel that appointments are rushed, and physicians may have fewer opportunities to focus on listening and addressing patient concerns in depth. Burnout can also affect organizational performance in several ways. Increased turnover creates recruitment, onboarding, and training costs that place financial strain on healthcare systems. Staffing shortages can increase workloads for remaining employees, creating a cycle that further contributes to burnout. In some cases, burnout may contribute to medical errors, reduce patient care satisfaction, and lower overall quality of care. Therefore, addressing physician burnout benefits both employees and the organization as a whole. This case is fundamentally a human resource management issue because it involves employee well-being, job retention, and organizational effectiveness. The challenges described in the case directly how employees perform their jobs and how organizations support their workforce. Human resource professionals are responsible for creating work environments that support employee success and well-being. In this case, physicians were experiencing excessive job demands that negatively affected their performance and satisfaction. The introduction of AI technology also creates management challenges, as employees must adapt to new systems, workflows, and expectations. HR must help ensure proper training, communication, and employee support throughout the implementation process. Therefore, human resources plays a critical role in helping organizations balances with employee needs. If this issue is not resolved, several negative outcomes may occur. Physician burnout may continue to increase, leading to higher turnover rates, workforce shortages, and greater difficulty retaining experienced healthcare professionals. Organizations may also face rising recruitment and training costs as they attempt to replace departing employees. Patient care may suffer as exhausted physicians struggle to balance administrative and clinical responsibilities. Productivity could decline, employees' morale may decrease, and collaboration among healthcare teams may become more difficult. Over time, persistent burnout could damage the organization's reputation as an employer and healthcare provider. These consequences demonstrate why addressing burnout is not only an employee well-being issue, but also a strategic priority for healthcare organizations. There are several important lessons that we can learn from this case. First, technology can be both helpful and challenging. While electronic health records improved documentation capabilities and information accessibility, they also contributed to administrative increased burdens that affected physicians' well-being. Second, employee well-being should be considered a strategic organizational priority. Burnout affects not only individual employees, but also organizational outcomes such as retention, productivity, engagement, and patient care quality. Organizations that invest in employee support are more likely to achieve sustainable performance. Finally, successful innovation requires balancing efficiency, employee acceptance, and patient safety. New technologies such as AI scribes can provide significant benefits, but they must be implemented carefully to ensure that they truly reduce workloads and improve the employee experience. In conclusion, the central issue in this case is physician burnout caused by extensive documentation requirements and the challenge of implementing AI technology. This issue developed as documentation demands increased, creating additional stress and administrative burdens for physicians. This issue is important because it affects employee well-being, retention, organizational performance, and patient care. Mass General Brigham's decision to explore AI scribe technology reflects an effort to reduce administrative workloads and allow physicians to spend more time focusing on patients. However, successful implementation requires careful planning, employee support, and ongoing evaluation. If left unresolved, burnout could lead to staffing shortages, lower morale, reduced productivity, and decreased quality of care. Ultimately, this case demonstrates that organizations must balance technological innovation with employee well-being to achieve long-term success and maintain high standards of patients for your care. Thank you for your time and listening to my presentation.